Okay, how are you everyone? I hope you are fine. This is a continuation of our lecture series, and this one is particularly about nursing as a developing profession. We are going to talk about nursing as a profession, and sometimes people say nursing is just an occupation, but we are going to identify those clear characteristics that identify nursing as a profession. So we will begin right away, and to describe nursing as a profession, we have to first talk about profession and professionalism. So nursing as a profession, first of all, a profession is a calling that requires special knowledge and skilled preparation. That means that someone has to go to school, someone has to be prepared with the necessary knowledge and skills in order to belong to that profession. So a profession is generally distinguished from other kinds of occupation by how do we distinguish profession from occupation? First of all, its requirement of prolonged specialized training, acquiring a body of knowledge pertinent to the role to be performed. So that means that the person who wants to belong to that profession has to go to undergo prolonged preparation. So for instance, if you want to belong to the nursing profession, you have to go to a university and undergo a 4-year training program uh, so that you can become a nurse. And then an orientation of the individual towards service, either to community or organization. So after you have finished your 4 years of training, you have to uh, go undergo an internship program so that you are oriented for service in that profession. So what is the criteria of a profession? Professional status is achieved when an occupation involves practice. Indeed, nursing involves practice. A profession carries great individual responsibility and based upon theoretical knowledge. Okay, so like right now you are studying, you are getting theoretical knowledge that is preparing you to become a professional nurse. Then the privilege to practice is granted only after the individual has completed standardized program of highly specialized education and has demonstrated an ability to meet the standards of practice. So you have to pass all the courses, you have to pass all the placements, clinical placements, internship placement, community placements. You have to pass all these placements in order to qualify as a professional nurse. Then the body of specialized knowledge is continually developed and evaluated through research. So there is a lot of research going on right now in the nursing profession. Many nurses are researchers and they are contributing to the body of nursing knowledge on a daily basis. The members are self-organized and collectively assume the responsibility of establishing standards for education and practice. So there are so many professional organizations in nursing, like the American Nursing Association, okay, the Uganda Nurses and Midwives Association. All these associations, their intentions is actually to bring about organizations and certain special roles such as collective bargaining. For example, when nurses are not getting enough salary, These are the organizations that will lobby for the nurses, for instance, to get higher salaries. Okay. So let's compare profession and occupation. So is this an occupation? Is this an occupation or a profession? Is this an occupation or a profession? What do you think? What do you think, students? Let me see your thoughts in the comments below, because I want to know whether you really understood profession and occupation. So let us pass through some of the differences between an occupation and a profession. So, like I have said here above, we have so many people doing certain things. We have, for instance, this is a border man. Can we call that an occupation or a profession? Is this a lady who is a cleaner or perhaps a housemaid in a home? Is that an occupation or a profession? Is this doctor? Is that an occupation or a profession? Let me hear your thoughts on that. Then, so let's see the differences right away so that it can help you give informed comments. So, first of all, in an occupation, training may occur on job. Training may occur on job. So, meaning you wake up and you go and you say, from today, I want to start doing this, and you start doing it, and then you gain the skills as you are doing the job. And then but for the profession, education takes place in a college and university. So you cannot wake up one day and you say, I want to belong to this profession without going to a college or university. And then for an occupation, length of training varies, but for a profession, education is definite and prolonged. So you know that to become, for instance, a lawyer, I have to train 5 years. It's not just 5 days and you are already a lawyer. No, you have to take some time training for a very good amount, a very good number of years. So in an occupation, value, beliefs, and ethics are not prominent features of preparation. That's why, for example, for certain jobs, people can speak whichever way they want. They can abuse people, but for a profession, values, beliefs, and ethics are integral part of preparation. So there is a certain way you must speak if you belong to that profession. If you are, for instance, a footballer, there is a way you should act, okay, for us to say that you are a professional footballer. Commitment and personal identification are strong. Okay, commitment and personal identification vary. I think this should have been the other way around. Then works are autonomous in an occupation, but works are supervised in a profession. Okay. So professional development in nursing can be viewed in relation to specialized education, knowledge-based ethics, and autonomy. So what are the roles of the professional nurse? The nurse is a caregiver, the nurse is a communicator and a helper, the nurse is a teacher, the nurse is a counselor, the nurse is a client advocate, in that if the patient wants something not provided for by the nurse, for example, if that service is provided for by the doctor, the nurse calls the doctor and say, hey, this patient needs such a service. In that way, the nurse is being an advocate to his or her patient. Then a nurse is a change agent, the nurse is a leader, the nurse is a manager, a researcher. Okay, all those are roles of a nurse. So let's briefly look at nursing education. Uh, Nursing education, we have what we call practical nursing. These ones study for many years. the practical nurse, actually in Uganda today, the practical nurse is a certificate and diploma. Those are known as practical nurses. Though the term has not been officially adopted in Uganda. For instance, in Uganda, the certificate nurse is called an enrolled nurse, and the diploma nurse is a registered nurse. So, yes, even degree nurses are registered nurses. So from diploma and above, we call them registered nurses. And then certificate nurses are called enrolled nurses, but all in all, certificate and diploma nurses are practical nurses. They are technicians, in other words, while the degree nurses are managers, or in other countries, they are the ones who are the true registered nurses. Okay, the duration of training is that, of course, and in other countries we have what we call, like Canada, United States, we have what we call licensed practical nursing. These ones are certificates, would be like the certificate nurses in Uganda. Uh, but in these countries, they are known as licensed practical nurses. And then we have registered nurses. These are, as I have said, uh, in some countries like US, Canada, you will find that these are nurses with diplomas, associate degrees, and baccalaureate, meaning degree in BSN, or Bachelor of Science in Nursing. Then, so today, the diploma program was brought into nursing to assist and as a move to make sure nurses are more educated. Then from diploma, we have what we call the associate degree, like what is trained in Canada. Before you actually get your degree in nursing, you can get your associate degree. And then you get your degree in nursing. Okay. So from degree in nursing, you can study a master's program. In Uganda, we have Mbarara University that offers masters in nursing with a specialization in critical care. Uganda Christian University Mukono offers masters in nursing education. Makerere University offers a master's related to nursing, but not really a master's in nursing. It's called Masters in Midwifery and Women's Health. Those are the only universities in Uganda that offer uh, training in nursing beyond degree level. Okay. Then we have doctoral programs. There are nurses who study up to PhD in many countries, and then those ones become doctors because they have done a doctor of nursing. Okay. So from doctor in nursing, you can become a professor of nursing. Okay. So we that summarizes nursing, actually nursing education. So for you now, you can study and become a degree nurses, and then after the degree you can study up to the master's program, and then you can, if you want a specialization that is not in Uganda currently, like you want to study masters in pediatrics, it means you will have to fly and go to another country where you can do that specialization, because currently many specializations in nursing are not offered in Ugandan universities. If you want to do a PhD in nursing, you also have to go outside Uganda and attend that program. Okay, so thank you for listening to this lecture, and we are going to learn about socialization in nursing. Thank you very much for your attendance, and have a good day.